I'd like to introduce Andy Abrahams-Wilson. He is director and producer of the documentary Under Our Skin, which screens at the Santa Fe Film Festival this week. Welcome to the Radio Cafe.
Thank you.
This is an absolutely amazing documentary about Lyme disease, which it turns out most of us know very little about. At least that was my experience after watching the documentary. First of all, what is Lyme disease? How and when was the pathogen that caused it discovered?
It's a big question and a large can of worms. What is Lyme disease? The pathogen, the bacteria that causes Lyme disease, was discovered about 30 years ago, and it is a cousin of syphilis, so it's very similar to syphilis and has a lot of the similar symptoms, as a matter of fact. But the standard view about Lyme disease is that it's easy to diagnose and easy to treat. And therein lies the problem, because the doctors who are the so-called Lyme literate physicians who are working on the front lines day in, day out with Lyme patients are saying, no, this is not easy to diagnose and it's not easy to treat. Patients go chronically infected, and if they're not treated early, if they're not diagnosed and treated early, they can go on to have symptoms, long-term symptoms, possibly for the rest of their lives, and that it, in some cases, is fatal, and that it can be transmitted to their children, just like syphilis was transmitted in utero, and possibly even sexually transmitted. So it is possibly a very, very big epidemic that is going under the radar.
And so all of these things that you mentioned, I'd like to talk about. First of all, let's talk about diagnosis. First, it seems that many doctors don't look for it, but even when they do, the test yields a lot of false negatives. What's going on? Why is the testing not good enough, and is it improving?
Well, to answer the second part of your question, is it improving? I think I'd have to say no, it's not improving. As you said, there are a lot of false negatives. And one of the problems is that there are many strains of the bacteria, and the standard tests only look for one strain. And it's generally accepted by, again, the Lyme literate physicians, the ones who are working with Lyme patients, that the standard tests, not only are they not looking for different strains of the bacteria, but that they're also not very sensitive, and that they're missing some of the telltale markers of Lyme disease. Also, all patients don't create antibodies right away, so that's a problem. And sometimes antibodies are not created at all because of the way the bacteria act inside of the body. So we're actually going into sort of deep science here, and there's a lot of unknowns. And I think what is certain, despite the disagreement, is that we need more research, and our diagnostic tools need to be sharpened, and as well as questions around treatment.
How widespread is Lyme disease?
Excuse me?
How widespread is Lyme disease? How many cases are there?
Well, the CDC reports that there are around 20,000 cases per year in the United States. Now, by their own estimation, this is off by about tenfold. So that would put the number at about 200,000. And just to give you a comparison, the AIDS numbers are about 30 to 40,000 per year. So it's a larger epidemic than AIDS, if you look at it that way. But the cases are not nearly accurate because all states don't have mandatory testing. Physicians, or rather mandatory reporting, physicians are not looking for the disease and don't know how to spot it. And like I said, even if they do, that they're not reporting it. And partly they're not reporting it because of if you're branded with Lyme disease, or chronic Lyme disease, you will probably lose your insurance coverage. You will not get covered for chronic Lyme disease because it is not, by most insurance companies, listed as a valid medical condition.
How is it treated at early stages, if it is caught early, and subsequently?
Well, the most common treatment is antibiotics. And if Lyme disease is caught early, then that's the best defense. And it usually eradicates the bacteria. But the problem is people are not getting diagnosed early. And so they go on and they get chronic infection, and it's much more difficult to eradicate at that point. But I think it's also important to say that what is seen as Lyme disease now is not just infection with the Lyme disease bacteria, that it's probably a matter of co-infections with other organisms that are commonly found in the gut of the deer tick, which is how Lyme disease is generally transmitted.
Now that's a very interesting point. The Lyme disease is transmitted through ticks, through these deer ticks, and the Lyme disease bacterium that is known is only one of the pathogens that's really causing the illness that doctors are seeing as Lyme disease. There's all these other co-infections going on. Is that why the rate of it is going up, because of these other factors, these other pathogens?
Well, you're asking me a lot of medical questions, and I think I should make it very clear to the audience that I'm a filmmaker.
Right.
And I'm a quick study, I guess, and I think it's valid to say I've become an expert on Lyme disease, but I'm really a filmmaker, and I can tell you what I found from my research, but I'm really not the authority in terms of certain medical questions, and that's why I'm usually the one who asks the questions, and
right.
And those are the people that I interviewed for the film.
Well, let's talk about, one of the narratives of the film is the resistance in the medical community to diagnosing and treating the illness, and it really sounded like the early days of AIDS and HIV, except the people who have Lyme disease don't have the same stigmas. In the early days of AIDS, it was gay men, mostly gay men, and in the 80s, Haitians,
Mm-hmm.
both of whom were stigmatized communities in their own ways. The people who have Lyme disease, it's named after Lyme, Connecticut, which is this white upper middle class community. Why the stigma?
Well, first of all, I think that's a very valid comparison with AIDS, and with AIDS in the early part of the epidemic, that it was stigmatized, and there was very little known. Just in the same way that we're seeing the same thing with Lyme disease right now, that people are not taken seriously, and very little is known, and there's certain assumption about what is known on the part of the medical establishment. But we're finding day by day that we don't know as much as we think about. Now, in terms of the stigmatizing of the people with the illness, people with Lyme disease are stigmatized, and whether they're from Lyme, Connecticut or not, they have routinely been told by their physicians at some point that there's nothing wrong with them, that it's all in their head. This is something that I've heard from almost, I'd say, 90% of the hundreds of people that I interviewed for the film, that at some point, as they've gone down the very long road of trying to find answers for what's wrong with them, they've been told time and time again that there really is nothing wrong with them, that it's just psychosomatic, that it's in their head.
Which is such an incredible insult when the symptoms that people have are so dramatic. Some of the people whose stories you follow closely in the film over a long period of time are people who were athletic, healthy, robust people who were just leveled by this disease
Right.
and yet told that it was psychosomatic. I don't understand. It's hard to understand how that can. What's up with that?